My name is Kristin Bean. I'm a PA for Women's Health First. I've been working here for 5 years, and within that time, I also became an IBCLC, which stands for International Board Certified Lactation Consultant. We are lactation consultants who have achieved the highest credentialing in the field of lactation. And we provide support, education, and encouragement to breastfeeding moms. One of the really nice things about being both a PA and an IBCLC is that whereas most lactation consultants would need to refer out to a physician or another provider for certain medical issues, like a breast infection, for example, or various procedures on the breast, because I am also a PA, I am able to prescribe any medications that are needed, and so that's really nice for our patients to not need to be referred elsewhere. So this may be surprising for some people to hear, but there is actually very little to no lactation education given to physicians or PAs in medical school. We do learn a bit about the breast and how to help with breast infections, but as far as latching or milk supply or troubleshooting issues, that's just not something that's typically in the curriculum. Many OB/GYN providers or pediatric providers will do their best to give advice, and I think for a lot of, especially female providers, they're possibly giving advice based on their own experiences if they're mothers and they've breastfed themselves. And sometimes that advice can be helpful, and sometimes that advice is not helpful because every mother-baby pair is very different. And what works for one baby may not work for another baby. And so I had a lot of patients who were getting very frustrated with breastfeeding issues, and I was honestly having trouble finding a place to send them. Me being a provider means that I can actually bill the consults through insurance, so this is of little to no cost to most of my patients. I also could not find even one lactation consultant in the Chicago area that was Spanish-speaking, and so I definitely saw a need there for my Spanish-speaking patients to have someone to support them in that way. There are so many benefits to breastfeeding for both mother and baby. We'll start with the mother. Not only does breastfeeding reduce the risk of breast cancer, but it reduces the risk of ovarian cancer, of type 2 diabetes, and of obesity. There are even more benefits for breastfed babies. Breastfed babies have lower incidence of juvenile cancer, lower risk of dying from SIDS, lower risk of obesity, diabetes, allergies, and asthma. One thing that I think is a truly amazing benefit of breastfeeding is that milk is what we call dynamic, meaning that it changes based on what your baby's needs are. So for example, if someone is sick at your house, if there's a virus going through the household and you're a breastfeeding mom, your body picks up on that, produces antibodies in the milk that then transfer to your baby so that your baby is less likely to get that infection. It's really this sort of living thing that responds to exactly what your baby needs in that moment. And there is no formula on earth that can do that like a woman's body can. And the best part is that breast milk is free. Some of the issues that I help women with during a lactation consult include milk supply. That's a big one. A lot of women are worried that they're not making enough milk for their baby, and they need some reassurance with that, or perhaps a plan to sort of help figure out how they can make more milk. So that's a very common one. I also help women with latching issues. Many women have trouble latching their baby, and there are various reasons for that. One common reason is if a bottle is introduced very early while that breastfeeding relationship is still developing. That's another thing that I help women with a lot, is transitioning baby back to breast. Maybe they still want to use a bottle occasionally, but they want to also be able to breastfeed directly. The thing that I love most about being a lactation consultant is being able to provide that support and encouragement to breastfeeding moms. The other day, I was able to help a woman latch her baby onto the breast for the first time. She had been trying to do this for weeks at home and was pumping her breast milk and giving a bottle. We tweaked a few small things and baby latched right away and fed for 20 or 30 minutes and was full and actually fell asleep during the session. The pride and relief on that woman's face was so palpable in the room that I actually physically felt like I was feeling her relief and her pride. Moments like that is what really prompts me to keep learning about this field and do the absolute best that I can for these amazing women.